wonderful news. And it looks like the cryogenesis is still working on them. So let's just examine them and dethaw the cryogenesis. Yes, indeed. On the computer now. Let's allow it to dethaw. And the first thing we should be seeing, perfect, just the eyes melting from the forehead to the chin, shoulders to what is presumably the hips or the thorax, and legs, and then the feet. Good. But it does still look like they are just a bit asleep. The protocol on the computer says to tap on the forehead. Let's do it. Marvelous. Hello there, human, and welcome to outer space. I am Alien 24601, otherwise known as Stella, and you are the first human ever from Earth to be on this space station for outer galactic studies. Yes, you signed up on a web forum to be a person to be examined and learn from a human from Earth. Are you still okay with this? Marvelous. Do you remember when you signed this? Very recently. Marvelous. What we are going to do today is a head-to-toe exam or a full-body exam, where we're going to be seeing how your body moves and works, and calculating, such as you have a forehead, you have eyes, you have ears, etc. This is okay with you? Marvelous, darling. I am the space doctor here, so we were going to get right into it. Good. First things first. Is it okay if I touch your face? Marvelous. I'm just going to carefully feel your skin texture. And I'm going to ask you to do something for me. Can you open your eyes very wide? And can you close them? Marvelous. Humans have the ability to open and close their eyes. Good. Keep looking at me, dear. I'm going to ask you just to sit still. Good. I'm going to check your eyes first. And do you only have 2 eyes? I presumed humans from Earth had 4. Does everyone have 2 eyes? Okay, so there are people with 1 eye. Marvelous. So, dear, I'm going to ask you, can you follow the light for me? I have a pen light here. I'm going to ask you just to simply follow it. Good, looks like the human eye can move. Focus on the light. Good, look at it. Marvelous. Wonderful. Good. And assist your left to your right. Good. And assist your left to your right. Marvelous. Look up and down. Good. I'm going to take a closer look into your eyes, ever so slightly. And I'm going to ask you just to sit still and relax. I'm going to just take a quick look. Okay, and can you blink for me like so? Good. raise your eyebrows. Amazing, and let them relax. Can you furrow your brow? Marvelous, right there. I'm going to tap. Amazing, relax right there. Relax, good. Can you close your eyes as if you were trying to hide your eyes? Marvelous, I'm just going to feel musculature features in the human, especially after a cranial nerve exam, are quite particularly strong. Very nice. Relax your eyes, darling. Can you give me a very Hollywood smile? Good. And is Hollywood a place where a lot of movie stars are? Wonderful. I have seen a couple of movies from Earth. They are very interesting. Yes, indeed. My favourite one of all time is one called Winnie the Pooh. Isn't that wild? It's like a little stuffed animal. It's very cute. Now, can you frown? Just frown for me. Wonderful. And relax. Relax, relax. Good. I'm going to feel underneath your jaw, called lymph nodes. We have them as well in outer space. Gonna just feel that. Relax. 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 Marvelous. It feels okay. And how often would you say you get sick on Earth? Is it like an everyday occurrence, or is it like a once in a lifetime? Okay, a couple of months or so. Wonderful. Good. Now, before I examine your scalp, I do have to cleanse it, because Earth is kind of a not so clean place. Just going to carefully sanitize. We do have something out here called space lice, and they are very difficult to remove unless you have the proper tools, like we do. Gonna cleanse that. Good, and then on the shoulders, arms, and on the legs. Marvelous. Good. You are all clean now. And we're going to move on with the scalp and the ears. I have these tools here, and these are little tiny hair brushes at the very end. We're going to examine the ear health and the scalp health, okay? Good. I'm going to start off right here. You do have hair. Wonderful. Marvelous. Going to check this side. Here. Okay. I'm gonna get more close into that now. Okay, looks like you do not have space lice, is what we call it. I'm going to quickly get my brush. Just going to find out myself very carefully. Okay, on this side. And it looks like we're good. I'm going to take a couple of photos of that now on the scalp. Just sit still and just look at the circle. Marvelous. And the other side. Marvelous. Good. Now we're going to take a look at your ears. And we have a tool known as an otoscope. I got this from Earth. It is a medical tool. Just going to take a look inside your ears, okay? What I'm going to do is look at each side, and all you have to let me know there's one ear canal for the ear, looking at the other one. Okay, it looks like you do have some sort of wax build-up in each side of the ear. I am going to switch the tool right here, this one, to do anti-cleansing mode. And I'm going to use an ear cleaner and solution to remove it, okay? So what I'm going to do is I'm going to add a couple of drops in that very carefully. And then we're going to give you a hearing exam. Marvellous. Just one drop there. And on the other drop on the other side. Perfect. Now I'm going to just simply massage that into the ears. Good. So just like so. Okay. Does that feel a bit better? Marvellous. So I'm going to cleanse the ear now. I'm going to take just one more look with my glasses. I'm going to just carefully cleanse that. Good, and just relax, okay? Marvellous, and the other side now. Marvellous, and very quick removal. Now, do you make that wax yourself? Are you able to identify how much you can produce? Okay, and I do know that you have candles made of wax. Is that the same thing? Just not, let me write that as a note down. Okay, and can you control when or when you do not want to hear something? You cannot. Particular. Interesting, okay. I'm going to just carefully get a sample out just from your ear, okay? I'm going to send this into our laboratories here on outer space so that we can get a better analysis of what the ear is like, okay? I'm just going to open this. Okay, I'm going to just get a sample really quick of each ear. And the other side. Perfect. Good. Sending this into our laboratories for a human specimen. Good. And now your ear exam. I'm going to put my hands beside your ears, okay? And I want you to let me know when you are able to hear a sound. I'm going to get a small machine that's going to make a beeping sound. And it's only just a couple. Let me know if you hear it from your left or your right side, okay? Marvellous. So I'm going to just cover your eyes and I'm going to put them next to your ears. You let me know if you hear it from the left side or your right side just by raising your hand, okay? Marvellous. Just going to cover your eyes now and let me know left or right side, okay? Left or right? Good. Left or right? Good. Left or right? Good. Left or right? Good. Left or right? Marvellous. Absolutely stunning. You did great. So, the human ear can hear about up to 5,000 in that type of Was that sour or sweet? Good, I did see your mouth go very, very sour. This is lemon juice from Earth. Very delicious indeed, if I do say so myself. And I'm going to now give you just a quick test of smell. I have got these essential oils from Earth, and we're going to assume out of 5 that you get at least one correct. And this can be any earthly human smell that we got, and a lot of them are quite soothing, if I do say so myself. Just let me know. I'm going to let you smell that, and you take a guess what it is. Good, good. So, just let me know if you're able to smell that. It smells quite lovely in my opinion. Good. And what does that smell like on Earth? A bit like floral. Very good. It does, yes it does. And it smells a bit like a spore. Perfect. And what do you think that could be? Yes, this one is lavender. Now this one is gorgeous. It's in a purple bottle, just like the flower. It is reminiscent of a floral light smell with a hint of like a paisley. It's quite nice. On to the next one. This one is going to be a bit more peculiar. We have a couple of plants that smell like this on our planet. So this one is a bit more earthy, I will say. Okay, and take a guess what this one is. Okay, a bit earthy, a bit like minty, yes, but not quite mint, understandable. And a bit planty, understandable. And what do you think this is? Some sort of plant, medicinal, understandable. This is vetiver, and a lot of people use this as like a perfume base. It's quite nice, but I would say that you got that right, as you were able to establish it's kind of a minty, sort of natural smell. I'm going to write that down though. I'm going to pull another essential oil out. Okay, this one is quite lovely indeed. So this one is a bit more, I would say, potent, yes, and it is plants, yes, natural, kind of citrusy, yes it is, and quite natural, exactly. And what do you think this one is? Okay, this one actually is lemongrass. Lemongrass is like a citrus plant. It's quite strong. We don't have anything like that on our planet, but it is quite a strong one. Okay, and we are on our 4th one now. This one is a bit more relaxing, I will say. Yes, quite relaxing indeed. What do you think this one is? Oh, minty, exactly, right away, perfect. This one is eucalyptus. So you got that totally right, perfect. And on to our last one. This one is a bit more different, but in the same category of the last one. Perfect. What does this one smell like? Perfect, natural, sweet, minty, minty again. It's not eucalyptus, so what is it? Perfect, this one is peppermint. Peppermint is a gorgeous plant, definitely used to treat a couple of toothaches from time to time. We have seen that happen before. Marvelous, looks like your nose, and it does look like your cranial nerves are working perfectly. Humans are very intelligent, aren't they? Yes, they are, very surprising. It does look like you do have a skeletal feature. Humans have skeletons. Are you able to move your skeleton around, such as to take the bone here and place it below if you would like to? No. And I did see here that you do have something, it's a capacity of rib cage around the lungs. When you do breathe, does the rib cage move, or does it stay in the same place? Interesting, interesting, interesting. And following along with the foot, a lot of planets do not have types of people with feet. It's just non-existent. Are you able to like maneuver the foot around? You are. We'll have to take a seat. We're going to move along now with a very quick muscular exam to calculate the rest of the body parts, okay? So we're going to see for movement on the body. If you could give me an arm first. Good. And there. And there. Good reaction for you. Arms are looking good. And can you put your arms backwards? Particular. Can you roll your eyes to the back of your head? No, not really. Interesting. Other arm. And there. And there. Amazing reaction for that. this reaction. And then your feet. Interesting. I'm going to just test what is known as the ankle, is what I've studied. Is that really what it's called? Interesting. I'm going to tap, just relax. And did you feel that? Good. And what about here? Did you feel that? Marvelous. Humans have such a dynamic system. And are you able to maneuver and roll the ankle? Okay, and you only have 2 sets of legs. Okay, and you only have 2 sets of feet. And I do notice that your fingers have the same amount of fingers on your feet. Is it the same always for people? Interesting. So you have 2 sets of hands, pretty much. Wow, that's spectacular. A lot of people do not. Other planets. I do say so myself. And I'm going to quickly test your distraction set to see if humans are able to focus. I'm going to ask you to choose one of the colours of the light. Let me know which one you choose. Good. I want you to focus on it. It's going to distract you. It's going to test to see how well a human's focus is from Earth. Yes. Yes. So choose one. Let me know which one you chose. Perfect. And focus on it. Do not get distracted by the other one. Good. Focus. Focus. Good. Focus. Focus. Good. Focus. Focus. Good. Focus. Don't look at the other one. Marvelous. Good. Now I want you to switch your focus and look at the other one. Okay, let me know which one you're focusing on now. Good. Switch and focus, switch and focus, switch and focus. Marvelous. Now you can relax. Good, you can quite relax. Marvelous. So humans' focus and attention to details are also quite serious. Okay, so okay. And quick countdown from the top to the bottom now. Good. You do have hair. Are there people without hair? Okay, bald is what you call them, bald people. There are people without hearing and sight as well, correct? Good. And are you someone who wears corrective hearing or corrective eyewear? Okay, we are some people who like to correct our hearing and eyewear often, and we also correct hair. Okay, and for your nose, I'm going to put pressure right there on what we call sinuses. Have you ever had something known as an allergy? Okay, and do you have any allergens that we should know of? Okay, we'll do that for future testing. Okay, it looks like you also had 2 ears, 2 arms, 2 hands with fingers. Do everybody have fingers? Okay, most people. And 2 legs, 2 feet, and about the same amount of fingers on your hands as they are on your feet. What is that word called for the fingers on your feet? Toes. Interesting. We'll write that down. And it does look like your general health is good as you are plugged into our system. Just going to give you just one more quick scan with our scanning machine. I'm going to ask you to place this on your face. I'm going to give you just a quick scan. I'm going to place this on your face for just a couple of seconds. We're going to scan all of the health parts in you. And breathe in. And breathe out. This is a red light therapy mask, which also gets your blood oxygen level, your heart rate, and it will get the fluctuation between heating and cooling in the body system to see how temperature fluctuates with relaxation. Good. And relax. Good. So, I do see here that your heart rate appears to be normal, blood oxygen level is also normal for humans. Blood pressure seems to be a little bit on the higher side. You're a bit stressed recently with work. And I did hear that humans live to work, is that correct? Quite peculiar indeed. Outer space aliens do not, because we prefer to care for the self. So I'm going to ask that you relax yourself, as you do seem a bit stressed more than usual, it seems. And we're going to let you know if you need to be sent back for any more exams, okay? Thank you for all the information. We got all of our laboratory samples that we will be sending in, and we'll let you know what we found from our examination of the first human ever. Thank you so much for participating in our space study, darling. Cheers, and you will be sent back to Earth by the cryogenize you now. We need to keep your shoulders just a bit more straight and relax and have yourself an amazing rest of your night's sleep. You'll wake up right back in bed by the morning time. Cheers, love, and thank you for participating in